So good day, ma'am. I'm Jason Libay Balit. I'm a student nurse from Davao Doctors College. So I'm going to perform wound care. So I'm from group 17. So here are the steps of wound care. So first, for the assessment, identify patient's identity using at least two identifiers. At least you can ask the name of the patient and ask for the birth date. The purpose of this step is so that we will know the identity of the patient and to make sure that we are giving the right care to the right patient. Good morning, ma'am. Unsay pangalan nato, ma'am?
Patricia Valerio,
Okay, ma'am. Kano sa atong birthday, ma'am?
August 10, 1998.
Okay. Thank you, ma'am. Tama. For number two, is we're going to review order for irrigation and type of solution that we're going to use for the patient's wound. Uh, this is to be done just to make sure the doctor's order and to make sure the proper solution is being applied to the patient. Okay, so we have here the doctor's order for wound care. And we're going to use the solution of normal saline solution for the wound of the patient. And for number three, assess patient's level of comfort and offers analgesic at least 30 minutes before removal. The purpose of this is so that we can assess properly the comfort of the patient and so that we can offer the analgesic for the patient because analgesic can help the patient at least relieve the pain during cleaning the wound of the patient. So ma'am, musta naman na to ang samad ma'am? Wala ba siya nagagut-ngut ko sa ma'am?
Duhay.
Okay. So, ma'am, maghatag dahil ko og tambal sa imo, ma'am, kay sa atong buhaton man god, limpyon man nato imong samad. Posible man gud na magsakit imong samad, ma'am. So kaning tambal nato makatabang ni para dili kayo magsakit imong samad habang ginalimpyon nato imong samad, ma'am. Okay? Number four is reviews medical record for symptoms related to patient's open wound so that we will know the if the wound has infection or the wound has if the wound is still bleeding or the wound has still uh, a lot of drainage on it. So at least we're going to see the possible characteristic of the wound of the patient. So reviewing record of symptoms of the wound of the patient. Uh, the patient is experiencing pain with a pain scale of 7 to 10 with the characteristic of knowing pain. Number five is assess patients for history of allergies at antiseptics, medication, tapes, and dressing materials. The purpose of this is so that we will know if the materials that we are using is safe to use for our patient. So ma'am, ano ko yung question sa imo ha? Allergic ba ka sa mga latex or kanang sa mga gloves? Okay. Kanang basig allergic ka sa mga saging, ma'am? Ano? Lipod sa mga tape or mga cotton na ginagamit sa imo ha? Wala, dili ka allergy na. Okay, good. Now for our planning. The first step in our planning is identify expected outcomes. So ma'am, maghatag na ko og tambal sa imo ma'am ha para habang ginalimpyuhan nato imong samad kay dili kayo magsakit ang imong samad during sa paglimpyo nato. Okay, okay ma'am. Number two is administer analgesic 30 to 45 minutes before procedure if needed. So, we're going to give analgesic to the patient so that the analgesic can help the patient to relieve the pain while we are cleaning their wound. Number four is gather appropriate supplies. In this procedure, we need to at least ready all of the materials that we need so that we can manage our time properly. So for our materials needed, so we have our syringe, kidney basin, our waterproof underpad, our cotton applicator, our marker, normal saline solution, our alcohol, our biohazard plastic where we can put our contaminated materials later. And we also have our PPE here. We consist of our face shield, mask, gloves, and our gown. And we also need the tape, and we also have our here. It's either we're going to use for this procedure, we're going to use just a bond paper to work as our dressing for the wound of the patient. And for the last one for our planning is we need to provide privacy to our patient and perform hand hygiene and position patient appropriately. The purpose of the privacy so that the patient will be more cooperative if we have or keep their privacy. And next is the purpose of the hand hygiene is to at least make ourselves clean and lessen the spread of microorganisms and position the patient appropriately so that the patient is more comfortable while doing this kind of procedures. Sa nato ang portahan ma'am no para natay privacy sa imong sa pagligo sa imong samat and maghugas lang sa kuog kamot para safe ta during the procedure. And now for our implementation, first step is perform hand hygiene. The purpose of performing hand hygiene is so that we can lessen the spread of microorganisms and to keep us nurses clean and prevent the spread of uh, the microorganisms to our patient and to prevent contaminations. Number two is forms a cuff on a waterproof biohazard bag and place it near the bed. The purpose of this so that it is more accessible if we need to throw a contaminated material into our procedure. Number three is we're going to apply PPE and uses sterile precautions if needed, and discards all dressing and use gloves and perform hand hygiene. The purpose of this so that we, as a nurse, we are protected during the procedure of cleaning the wound of the patient. So this is our way of protecting ourselves during the procedure. But for procedure purposes, I'm going to remove my face shield and mask so that you can hear me properly during the procedure. So for number four is we're going to apply green gloves and we're going to perform wound assessment. In our wound assessment, we need to know the color, consistency, the characteristic, and the amount of drainage of the wound. Okay, so after putting our gloves, ma'am, sakit ba pag binita ni ma'am sa bag? Hindi man. Okay, so now we're going to check for the color, consistency, the amount of drainage, and coloration of the wound. Number five is exposes area near wound only, so that we, if we're not assessing the other parts of the body, we don't need them to be exposed during this kind of procedure. We only need to expose the part where is the location of the wound. For number six is we're going to irrigate wound with wide opening. So in this step is there are at least four steps in this irrigate wound with wide opening. So first is we're going to fill syringe with irrigation solution, or in this case we're going to use This is a saline solution. And next is attaches 19 gauge Agio catheter and holds syringe tip above upper end of a wound and over area being cleansed. And then is flushes wound using continuous pressure until solution draining was clear. So the purpose of the pressure being put to the wound is so that we will see uh, that the drainage or yung mga nana is kaya nating alisin doon sa wound just to make sure that the wound will be clean by our solution. So now we're going to remove your dressing, ma'am, ha? Okay? So, kailangan careful lang ito ang pagtanggal. Okay, para di sakit sa pasyente. Mostly, some of the tape are really painful habang ginatanggal. So, we need to immediately at least discard the old dressing of the wound. And we're going to remove our old gloves to prevent contamination. So, tabunan lang natin yung mga okay. Tapos, ang wound lang nyo mo ang ato ang i-expose yun. Tapos, magbutang ng taog waterproof underpad dito sa ilalim sa imong samad para di mabasa ang imong higdaanan habang nagalimpit sa imong samad. Okay, tapos magbutang lang kog kidney basin diri sa kilid para diri pod nato paagason tong katong solusyon na gamiton nato pang limpyo sa imong samad. So nga magbutang lang taog solution uh, para limpyan nimo ang samad mo, ha. So ayan kabala ka man dili man nato itusok sa imo, ha. So ikuha lang nato. Manang isalad nato siya sa kidney basin nato. Para matanggal jud ang nanasin ng samad. Tadlukan ni mo. Number 7 is we're going to irrigate deep wound with small opening. In this, we also have at least 5 step by step of this. First is we're going to attach a soft catheter to filled syringe, and then insert tip of catheter into opening, and flushes wound using I think slow continuous pressure. Pinches of catheter below syringe while in place. Removes and refills syringe, reconnects to catheter, repeats until solution drainage is clear. So you're going to repeat this scenario until um, the way we clean the wound is really clear. If not, ito gamitin. So for number 8 is we're going to apply clean gloves and clean wound with handled shower. Or in our case, we're just using a faucet to clean the wound in this step. We're going to perform hand hygiene, apply clean gloves, and adjust spray with patients seated. Ensured water was warm. So that we need to make sure that the water is warm, or the water is the patient can tolerate the temperature of the water, so that the patient will not get hurt by the temperature of the water. Next is showers for 5 to 10 minutes. That's how the average time of at least cleaning the wound in the water. So, wait lang mama. Ignan lang ko kung medyo init or bugnaw ba ang tubig. Tama lang ba?
Tama
Okay.
lang.
Sige ma'am, pagasan na natin mo tamad mama. So number 9 is we're going to obtain cultures after cleaning with non-bacteriostatic saline when indicated. So the purpose of this is we're going to get the a culture of the wound, so that we can send it to the laboratory to see if there are possible infections of the wound or whatsoever. So ma'am, magkuha ta og sample sa imong samad nun, no? Para ipadala nato siya sa lab para ma-identify nila kung nabay possible na basig na infection ng mga samad, or kung sa ba nahitabo sa imong samad, ma'am. So for number 10 is we're going to dry smooth edges with gauze pad and dry patient. Then the purpose of this is so that we will make sure that the area of the wound is dry, because we're going to apply another dressing to it. So i-dry lang sa anak ko yung tamad mga. Okay, next is we're going to apply appropriate dressing labels with time, date, and students' initials. So that the purpose of this is we need to put another clean dressing, so that the healing process of the wound will be more quicker and clean. So sige ma'am, buti na nato bagong dressing mo sa madlon, no? Okay. Then, buti na nato siya date and time. So, initials na ako ang nag-dressing sa inyo, ha? Buta na nato Then ang akong initials na okay, so matabot ka na bagong dressing, ma'am. So for number 12 is we're going to remove mask, goggles, and our gown. The purpose of this, so that because we're going to remove this, is we're actually done for our procedure and need to discard the possible contaminated materials, or um, those materials that is protecting us. And for 13 is dispose equipment and sold supplies, removes gloves, and perform hand hygiene. The purpose of this is to make sure that there is no contamination in our materials. We need to throw all of the contaminated materials, and we need to perform hand hygiene, so that there is no spread of microorganisms, and to prevent contamination from patient to nurse or nurse to patient. Ma'am, tagalan na natin ni mama kay manabot ta. So now is for evaluation. Have patient rate level of comfort. So the purpose of this step is so that we will know the feeling of the patient while having the new dressing of the wound, if there are pain on the wound already, so that we will be more aware of what is happening to the wound of the patient. So ma'am, kamusta naman yung mga samad ma'am? Wala ba nag-note yung mga samad ma'am?
Okay lang man.
Mas ni okay mong paminaw karon?
Ah,
Okay, good. So number two is monitor type of tissue in wound bed. We will determine if the patient have the sign of epithelial tissue. Epithelial tissue is a sign of a good proper healing of a wound. So based sa nakita nato sa mga samad kaganina ma'am during sa paglimpyo ng sa mga samad is natin nakita nga ang ginatawag is epithelial tissue, which is known siya para sa kanang ang isa ka samad kanang hapit na gani maayo or paayuhay na. So mga pila na lang ka semana or adlaw is mga okay na imong samad ma'am. Basta hapit na gid siya kay nana siya is sign sa epithelial tissue nimo. And next is four is evaluates peri-wound skin integrity and observe. And for number five is observes for presence of retained irrigant to make sure that there is no leftover of the solution that we applied to the wound of the patient to prevent skin irritation to the patient. So number three is we're going to inspect dressing once every shift or as ordered. So the purpose of this so that we can be monitoring the patient's wound from time to time if the wound is having an infection or the wound is still bleeding or has drainage on it. So we need to monitor it or as ordered by the doctor. Okay ma'am, mga taon-taon po ma'am is basig i-check po na ko imo ang samad kung nag-ano na ba siya or kung nakababay dugo na gagawa siya ng samad. Siguro i-check na ko siya bago mahuman ako ang shift or kung gusto ipa-check ni doc ang mga kuan, ang imong samad every 4 hours or every 8 hours. At least kailangan man jud ma-check imong ma-monitor ang imong samad para makabalota kung ma-infection, magka-infection ba siya or sa ba. Okay? And for the last one for our procedure is record and reporting. Is we're going to record procedure and perform and all findings in the patient's chart. As of this procedure, we're doing the wound care. So for number two of this procedure is report to healthcare provider any evidence of fresh bleeding, sharp increase in pain, retention or of irrigant, or signs and shock immediately. The purpose of this so that we can note or monitor properly the wound of the patient if there is emergency or infection on the wound of the patient. That's all. Thank you. So recording time of procedure at 8:25 a.m. We have done our procedure at the wound care. Next is there is signs of epithelial tissue, that's signs of healing, and there is no noted pain on the wound of the patient. So ma'am, nagasakit ba siya karon ma'am or nagangut-ngut ba siya gyapon?
wala.
Okay. Basta kung nakay ma-feel sa imo sa og something sa imo sama kung nagasakit ba siya or naganana, iigna dayon ni para maigna nato ang imong doktor kung need ba kahatagan og tambal or mga check up para maagapan tayo nato imong problem sa imong samad just in case ma'am ha.
Okay.
Okay, salamat ma'am.